when we're doing these amazing fetal surgeries on babies on the inside, we have 2 heartbeats that go into the room. An amazing surgery and procedure is done. Then we have 2 heartbeats that leave the room. And that's a time to celebrate because we have saved a life of another patient.
Welcome to the Blind Mom Life Podcast. I'm your host, Chelsey Painter Davis, blind wife, mother, and pro-life Christian speaker. I want to invite you to dive deep with my special guests and I as we talk conquering disabilities, cherishing motherhood, and choosing life. Are you ready? Action. And we're back. Season 2, Episode 1. It's time to go. Oh my goodness, what a crazy, long, exhausting summer it has been. But I am so excited to have here today an amazing guest for you to meet. But first things first, you know it, you love it. It's time to talk movies. So Steel Magnolias is one of my favorite films ever. And for those of you who have never seen it, I'm pretty sure that's a crime that you're going to need to resolve immediately. But it is the story of a beauty salon in the Deep South and the beautiful, crazy women who manage it and frequent it as customers. I love this story so much. I remember dragging my now husband Austin to see it when we were just engaged all the way to Murray's Dinner Playhouse in Little Rock, Arkansas. He enjoyed it a little bit, but I loved it. It was so much fun. It was one of my favorite dates we ever went on. It was great because the way that Steel Magnolias lays out femininity and the difficulties, the struggles, the laughs, the tears, the frustrations, the zany, crazy behavior that we have as women. Oh my goodness, it was so accurate and it felt so real in these stories, from the cranky Weezer to the confused and meek Annelle and the vivacious and confident Shelby. These women felt like friends I'd had for years. And the beauty and the truth in their stories, oh my goodness, it just connected with me in such a strong way. I especially love the role of motherhood in this story. There is so much that we ask of men in our society, and I know we love our sons and our husbands and our fathers. They really are expected to be made of steel to support our societies. But as we learn in Steel Magnolias, women are asked to be made of steel too. There is so much that we endure together, so much we have to accomplish, so much we are expected to rise to the occasion for. And we do. We really do, especially as we transcend generations through motherhood. Shelby in Steel Magnolias has such a beautiful and painful story as her and her husband Jackson are trying to conceive a baby and then worried frantically about her health after she does so. It is so hard to see what pregnancy does to a woman's body. It's difficult. It's not easy. It's a strain on our bodies, but it's so beautiful. And it's exactly what we were designed for as females. And it is so integral to our roles in society to mother others, to be there, to be compassionate, to be empathetic, to be kind, to understand, to nurture. Whether you have a child or whether you don't, it is in us to be mothers in our entire society. And I love how much Shelby exemplifies this need to mother, because it's so true. It's so true of so many of us. And I really appreciate how honest this film is about the pain when some of us are told that that might not be possible for us, or we're scared for our health when we're pregnant. These are real fears and to address all of these questions and all of these concerns that women have to deal with every day in our society for being female and wanting to nurture. I thought the perfect guests would be pro-life doc Bill Lile. Oh my goodness, it is going to be an amazing interview today. So I am so excited for you to meet him.
All right, Dr. Lile, I am so excited to be chatting with you today. Can you just tell our audience a little bit about who you are and what you do?
Sure. My name is Dr. Bill Lile. I practice obstetrics and gynecology. I'm licensed to practice in both Florida and Alabama. I'm calling from Pensacola now, and I've delivered over 4,000 babies and do all sorts of surgery. And in 1999, after I finished my residency at the University of Florida, the practice that I took over was actually the largest abortion clinic here on the Florida Panhandle. And we had the previous physician sign a restrictive covenant, a non-compete, so he couldn't practice any medicine for the next 2 years in our tri-county area. On day one, we stopped all abortions, all abortion referrals, and to this day, from the border with Alabama all the way to Tallahassee, our capital, we still don't have a single abortion clinic here on the Florida Panhandle. And we also, at that time, we started a ministry called prolifedoc.org, and I travel around the country and give expert witness testimony, speaking at pregnancy resource center banquets, and do a lot of work with Heartbeat International and CareNet and Focus on the Family, Dr. James Dobson, just trying to get these tools about patients' rights to the hands of those who want to defend life. We realize it's a spiritual battle, so we try to lead with our spiritual tools, and we've been very successful. And we, in fact, have a brand new curriculum which just got released this week, which is about 8 hours of video training of what an abortion actually is, with demonstrations with retired abortion equipment. But we also uniquely have developed a series of animations of how we treat the babies in the womb as patients. And patients have rights, and clearly if we are doing all these different procedures, surgeries, and even blood transfusions, they are patients, and so they should have patients' rights, and we have a duty to defend them.
I love that so much. So have you always been pro-life, or is that something that developed throughout you studying medicine? How did that happen?
I was always pro-life. Even when I grew up in New Jersey, grew up in a great, church, and I can still remember as a child of about 10 or 11 years old going to the pregnancy resource banquets in a city called Cherry Hill, New Jersey. And what's ironic is I've now spoken at their annual banquet twice, with my ministry. And so it's gone full circle, but always was raised with the idea that we're created in the image of God at that moment of conception. That was way before I really had an appreciation that I wanted to practice obstetrics and gynecology, and never thinking that I would have a side ministry aside from my private practice defending God's preborn.
So what got you interested in obstetrics and gynecology? Was it being around those pregnancy resource centers when you were a kid?
No, I think it was the only time when I always wanted to be a physician. I spent a lot of time as a child, having different surgeries performed, and I was always comfortable in the medical environment. And I think it was during medical school, everybody goes in and they want to have their minds open to what's going to interest them. And when you find yourself on, say, an orthopedics rotation, and you're doing orthopedic surgery, but in your spare time, you're reading more about obstetrics, that usually gives you a good idea. This is probably where I need to be practicing. Plus, bottom line, it was the only time people are happy to go to the hospital. I loved surgery. I loved operating, whether it was robotics or laparoscopic or open procedures. And so, but this was the only time where people were excited to be going to the hospital. And to have that honor of helping a woman and a husband bring new life into the womb, I mean, that's the happy part of medicine. So I just gravitated toward that happiness.
Yeah. So there's a lot when you're having a baby as a mom, and it is really, really exciting, but there's a lot that can be really, really scary. I know, I had my cousin's wife was so terrified when she was pregnant that something was going to go wrong. What would you say are like the most common fears you see from your patients when they come in about birth complications, pregnancy issues? What do you see them be scared of the most?
Well, similar to what any of us would experience. I mean, you're concerned about miscarriage. When you finally have that first positive pregnancy test and everything is new, you want to make sure that pregnancy keeps going. My wife and I dealt with that. We,
Oh, I'm so sorry.
after we were towards the end of my residency training at the University of Florida, and we were finally pregnant and we celebrated, and then she started to have some bleeding, and sadly we had a miscarriage, and then we got pregnant again and sadly had a miscarriage, and then we got pregnant a third time, and that was our oldest daughter, Sydney, but then another miscarriage, then our daughter Emily, and then another miscarriage. So we've had 4 miscarriages during our fertility career, and it's tragic. And we can even talk about the need for the church responding. The church will always preach that we're created in the image of God at that moment of conception, yet we tend to deal with the loss of, say, a 1-month-old baby that passes away in the NICU very differently from a mom who's had a miscarriage. Where if she's had a miscarriage and it's common knowledge in public, we don't seem to have people sending cards and calling and just saying, hey, I'm praying for you, or dropping off meals. But the church does a great job functioning as the church when a mom loses a baby that's, say, 1 month old. There are meals being brought to the house. There are people that say, how can I do your laundry? But when you have a miscarriage, you really feel ostracized. We even had people not only not say the right thing, but for some people, they said the wrong thing, where you're pregnant, you're celebrating, and then you have this tragic loss, and you're hurting. You've had one of the biggest losses in your life, and you're in pain. And I can still remember how painful some of the comments were to my wife. One woman came up to her when it was pretty well known that we had had a miscarriage, and I'm sure she was well-meaning, but she said, well, at least you know you can get pregnant. It's like, you got to be kidding me. You just said that to my wife? And then when we had 2 miscarriages and had our second child, but then had our third miscarriage, I still remember a woman came up to my wife and says, well, at least you have 1 child. It's like, these are the wrong things to say. And so we need to educate and train that, yes, the church needs to act as the church. If somebody loses a baby when the baby was 1 month old, absolutely pour out your hearts and function as the church. But that sense of loss is the same spiritually, and it's the same emotionally when you have had a miscarriage. You knew that there was a new creation created in the image of God at that moment of conception. We had done ultrasounds and we could see the heartbeat, and then you have that bleeding and that sense of loss, and you already knew what the due date was. You start making plans on changes on your house, and then when you go through that loss, it's tragic, and you go through all the same steps of grief that anybody would when they lost a mom, a dad, or a child. But we just need to know how to properly handle a miscarriage in the church, because of all pregnancies that happen for people who are trying to have a baby, about 20% of all pregnancies will result in a miscarriage. And a lot of people will think, well, it must just be me. Why is God punishing me with a miscarriage? When in reality, when women get together and they discuss a miscarriage, it's amazing that 20% of the women in that small little group will have gone through a miscarriage. And it's common. It's nothing that the mom did wrong, and it's nothing that the mom should have done that would have prevented it. It's one of those things that happens, but it has a huge sense of loss. And after having 4, I have a lot of empathy for my patients when they go through that. And so we need to, support our patients when we have the good days, but we also need to be there to help support them, pray with our patients in the office when they're having some of the biggest challenges they've ever had in their life.
I know that was a huge thought with my first pregnancy. I remember I would look up like every single week. I was like, what's my miscarriage risk this week? Now what's it this week? And watching the number going down as I was more farther along in the pregnancy. But it is. You're right. It's a very scary thing. What are some of the risks that you see like associated with mom, like things that moms can be come in scared of, and like what do you actually see in your practice when mom's life is at risk during a pregnancy?
Sure. Well, one of the first things before a mom is even considering pregnancy is prepare her body for the pregnancy. I mean, pregnancy is a challenge to a woman's body. Number one, we want them on a prenatal vitamin. We know that with proper folic acid, intake from a prenatal vitamin, we can cut the risk of the baby developing a condition, neural tube defect like spina bifida. We can cut that in half just by having enough folic acid on board. And a lot of moms, when they come into the office, they're like, well, I need to get started on my vitamins. Well, from that moment of conception, the spine will either close properly or improperly at day 28. So by the time a woman realizes she's pregnant and she gets into the office, by that time, usually at about 5 or 6 weeks gestation, the spine is already closed properly or improperly, and the baby
Wow.
has a spina bifida. So, preconceptual counseling is very important. Also, what medications are moms on? There are, blood pressure medications are very common. There are some blood pressure medications which are very safe to use in pregnancy, and there's other blood pressure medications which we don't want patients to be using during pregnancy. And then even as far as pain, medications, antidepressants, seizure medications, acne medications. It's real important that a woman sit down with her doctor and say, hey, we're planning on having a baby this year. Can we make some adjustments to my current medications? Also, being overall healthy. One of the biggest risk factors that we have here in the United States that affects pregnancy is actually obesity. And we have many patients that when they have health issues related to their obesity, whether it's diabetes or high blood pressure, it's very difficult. That's not the time to say, well, I know I need to, get my diabetes and high blood pressure under control and I need to start losing some weight. It's like, no, pregnancy is not the time to start losing weight. That needed to be done ahead of time. So we want the mom to be as healthy as she possibly can, whether that's medications, whether that's weight loss, exercise, eating properly before she becomes pregnant, because we have some limits as far as correcting health issues once a woman is pregnant.
Yeah, so that is really great going through the pregnancy. What are some issues that can come up in the delivery room? I know like when I was pregnant with my son, we were delivering, like his heart rate was dropping with the contractions, and then the doctors came in and they were talking to me about emergency C-sections, and my husband was downstairs buying a sandwich, and I was like, wait, what is going on? What are some reasonable fears that moms have with delivery, and then what are some really, I don't want to say unreasonable, but like less than likely where we don't really need to be so focused on them?
Well, everybody is afraid that their baby is going to die. I mean, that's a
Mm-hmm.
natural fear. Women will regularly fear that I'm going to go to the hospital, I'm going to go to my doctor's office, they're going to go to listen to the heartbeat, because every visit we listen to the heartbeat, and a fear is that there's not going to be a heartbeat that's there, especially on somebody who's already had a previous miscarriage. So sitting the woman down and saying, listen, you're doing everything right. All of your symptoms are normal. But until a woman starts feeling the baby moving around, there's a lot of fear. Some women will start feeling the baby moving around at 18 to 20 weeks. Other women, especially in their first pregnancy, that they might not feel that baby moving around until 26, 28 weeks. And it's kind of like if I'm in a room and somebody is on the other side of the walls of that room. I can be moving around, waving my hands. Nobody on the other room is going to know that I'm waving my hands in the air unless I actually hit the wall of the room that I'm in. So babies can be moving around inside. Moms will only feel that movement when the baby actually hits the wall of the uterus, which is essentially the room that they're living in.
Mm-hmm.
Most hospitals will have OB emergency rooms, where we have an emergency room that's dedicated just for pregnant women that they are welcome to come to 24/7. We have nurse practitioners and we have a board certified OB/GYN that is up there at all times if a woman all of a sudden says something is different. One of the most important barometers as far as the health and well-being of a baby is, what is the mother telling us? Moms are spending 24/7 with their babies in the womb, and so they know their babies' activity levels, they know their personalities, and when a mom comes and says there's something wrong with my baby is not moving normally, we take that very seriously because she feels that baby 24/7. So we always want to make sure that moms, if there's something that's wrong and something that's different, that's why we're here. Come on in and let's check. Let's listen to the baby's heartbeat. Let's maybe even do an ultrasound in the office. And we'd much rather have a mom come in, get checked, and then be sent home because everything is okay, than for a mom to wait and wait and wait throughout the weekend, show up at the office on Monday and find out that something tragic has happened and we might have been able to intervene. But during the pregnancy, enjoy the pregnancy. I mean, this is an amazing time of life. And for the most part, you're just helping a mom have a healthy experience with a normal, natural, part of life, having a baby. But we always want to make sure that we're available and we're there for them. And preterm labor is still one of the most common things that people are afraid of. And moms also need to feel comfortable that if they are experiencing contraction, so they're having any bleeding or having any leaking of fluid, those are reasons to go to the hospital, not to say, well, I have an appointment next week, I'll check with them next week. No, come on in now. We'd much rather, diagnose you and treat you while we still have time to make a healthy intervention than to just wait. So don't be afraid to call your doctor or to come into the hospital and get checked.
So when are some times that things can go wrong in pregnancy and it not just causes a risk to the baby, but it can cause risk to mom?
Well, whenever we have a mom who is pregnant, we have two patients, and that's a real important topic. We have the mom, who is obviously our patient, but the baby in the womb is our patient as well. And it's not just that we can see the baby and we have a positive pregnancy test and we can do an ultrasound. Technology has advanced to the point that with high-risk pregnancy centers, which my hospital is one, we take care of most of the high-risk pregnancies that are here on the whole western panhandle of Florida. So we handle triplets. I've delivered quadruplets. We handle the real sick moms, the moms that maybe have diabetes, have high blood pressure, or have other chronic health issues. Maybe they're even dealing with a cancer. And so we are there to meet their needs. But, as far as how many different high risk factors are there, boy, you spend a lifetime, learning to diagnose and to treat. I mean, it took me 13 years after high school to be able to get my license to practice medicine, of continuous training and learning. But there are some people who that wasn't enough for them. They wanted to go do more. So they spent an additional 3 years becoming a maternal fetal medicine specialist, a doctor who really focuses on the high risk aspects of pregnancy, because there are a lot of them. But the way science has really worked and the way the NICUs have worked, it's not just a matter of diagnosis and then this is going to be a challenge and we're just going to hope that you deal with it. No, even when it comes to challenges for the baby, we can now not only diagnose, but we can treat and we can cure issues in the womb. One of the most common things that we will treat and cure in the womb is when babies are having real low blood counts. And from the moment of conception, the mom and the baby are genetically unique. I mean, half of the time it is a different gender. The mom is female and half the time the baby is male. So they are very different people there on the inside. But moms and babies can even have different blood types. And sometimes moms will have antibodies which can cross the placenta and start to attack the baby's blood because the baby is a foreigner. It has different blood type. And the mom's blood and the baby's blood does not mix. Everything the baby needs comes across the placenta from the mom, and everything the baby needs to get rid of goes from the baby to the placenta to the mom, and then the mom gets rid of it. So there are conditions which it used to be when mom's body was attacking the baby's blood and the baby's body, sadly, we would just have babies that would pass away because they go into heart failure and die. But now we can actually diagnose this condition And with using special ultrasound technology, I can predict when a baby is going to get sick before a baby gets sick. We can actually see what a baby's blood count is by measuring the individual red blood cell speed when they're going through different arteries. There's one called the middle cerebral artery, and we can actually see when a baby is anemic. And what do? We don't just watch the baby get sick. We can actually give a life-saving blood transfusion for a baby in the womb with blood that somebody might have donated at their local Red Cross Center or One Blood. We can take that donated blood and we can actually put it in a syringe, guide a needle through the skin of the mom, through the wall of the uterus, go right up to the umbilical cord, place the tip of that needle right into the umbilical vein, and give that baby a life-saving blood transfusion. It wasn't too
Wow.
long ago these babies died. So now we can diagnose these babies, we can treat these babies, and we can cure these babies. And there's new technology every month when it comes to treating these babies in the womb as patients. We are now doing open heart surgery for babies in the womb where the babies actually have their own IV and their own anesthesiologist, and they're getting pain medications and they're getting a paralytic. And we are doing open heart surgery. We're now in generation 3 of correcting and curing spina bifida in the womb. We're doing laser vascular surgery for the placentas of twins. And even up at Boston Children's Hospital, they recently performed a brain surgery for a baby in the womb to save that baby's life. So the
That's incredible.
technology is changing. We've always known that this is a different person and is created in the image of God at that moment of conception. But now we are diagnosing, treating, and curing these babies, which gives us a great argument against abortion because we have most of the states in the United States actually have patients' bills of rights, where if I have two patients in an emergency room and they both need a blood transfusion, but one was born in the United States and one was not born in the United States, would we ever say that, well, the one that was born in the United States gets a blood transfusion? The one that wasn't born in the United States, you don't get a blood transfusion. We would never do that. We have patients and we treat them. But now we also have patients that have not been born in the United States yet. And that is a real important point where we have a duty to defend and treat all patients, regardless of their age, their race, their creed, their nation of origin. If you're a patient, you will be treated, and we will treat you with, compassion, because a patient is a person and is entitled to respect and bodily integrity. So we have now transcended to just treating the patients that are in our emergency room to treating and curing the patients that are in the womb. And all patients have rights, including the tiny ones in the womb.
So I think that abortion culture has kind of set up this false dichotomy where we see mom and baby as completely separate things, where they're kind of pitted against each other. Have you ever come across a situation in your practice where you had to choose between mom and baby, where like continuing the pregnancy was going to kill mom, or some kind of almost the way it's described in abortion culture is like a parasitic situation with the baby? Have you found that in your practice to be
Well, what you'll
realistic at
see,
all?
there are conditions where pregnancy is affecting the health of the mom. I mean, there are things that affect the baby and the health of the mom, like an ectopic pregnancy, where still the number one pregnancy related cause of death of women in the first trimester of pregnancy is still a ruptured ectopic or tubal pregnancy. And the pregnancy is landed in the tube or anywhere else other than the uterus, and it's starting to grow there. And that baby, I wish we had the technology where we could take that tiny baby and move it from a threatening area like in the tube and put it to a non-threatening area like in the uterus. We don't have that technology to do that change. So we have to look. Our goal is to have healthy moms and healthy babies. And when it comes to an ectopic pregnancy, we unfortunately cannot save the life of the baby, but we have a duty to save the life of the mom. There are a lot of other conditions in pregnancy which can be affecting the mom. Severe preeclampsia, eclampsia. I mean, moms can get really sick because of the medical conditions associated with pregnancy. But here is the absolute key. It is not killing the baby that cures the mom. It is the delivery of the baby that cures the mom. So, with the technology that we have with our neonatal intensive care units, we have babies that are surviving at 22, 23, 24 weeks gestation. So, if a mom has a condition where her health and her life are threatened because of the pregnancy, well, killing the baby doesn't fix the mom, it's delivery of the baby. And anybody who is practicing obstetrics and gynecology, they can safely deliver a baby in an emergency via a C-section. They can have that baby out in less than 60 seconds. And then give that baby over to the neonatal intensive care doctors. And with all the technology and the trained nurses, nurse practitioners, and doctors, and give that baby every opportunity to survive and thrive, because these babies are doing well. So sometimes we need to deliver the baby early, but again, it is the delivery of the baby that cures and heals the mom, not killing the baby.
I've heard a pro-choice OBGYN argue before that when you have to stop a pregnancy early, that removing of the baby is an abortion either way you look at it. Do you feel like that's a fair representation of what's happening when you have to deal with something like preeclampsia?
No, it's not. I mean, when it comes to even my patients, if I have a patient that came into the office and she had an 8-week baby and you could measure that baby, but the baby didn't have a heartbeat, well, we have options. We can't just leave this pregnancy, the placenta, the fluid, and the baby on the inside. So we have options. Option number one is we can wait and see what the mom's body does. Option number two is we can give the mom some medication which will help cause contractions and empty out the uterus. And sometimes either the bleeding is too heavy or the mom chooses and says, no, I'd like to surgically remove this pregnancy, which is no longer alive, from my body. And I've had patients come up to me months or even years later, and they've been told by their friends or their colleagues that if they had a miscarriage and the baby had passed away, unfortunately, and they had a D&C, that they had an abortion. They did not have an abortion. Abortion is when you are intentionally taking the life of a baby in the womb that still has a heartbeat. When a baby has already passed away, then you're just preventing infection from coming to the mom. I was actually on a college campus, and somebody said, well, there's no difference between an abortion and somebody having a D&C for a miscarriage. I said, yes, there is. I said, I want you to think about this story. If there's an individual that has a puppy in the trunk of their car, and then they pull off to the side, they dig a deep hole, and they place that puppy in the bottom of the hole, I said, is that morally a good thing to do? And immediately the student fires back, and she goes, well, it depends. Was the puppy alive or was the puppy dead? I said, same thing with the baby. It's morally wrong for somebody to dig a hole and put a living puppy at the bottom of the hole, but it's respectful for somebody whose puppy passed away to go, to a farm or to some open property and dig a hole and respectfully, bury that puppy. With an abortion, there are two beating hearts that walk into the operating room, and there's the mom's heartbeat, and then there's the baby's heartbeat. With an abortion, only one of those heartbeats leaves the room. When we're doing these amazing fetal surgeries on babies on the inside, we have two heartbeats that go into the room. An amazing surgery and procedure is done. Then we have two heartbeats that leave the room. And that's a time to celebrate because we have saved a life of another patient. So it's a real distinction. Right now, it's the number one form of an abortion is no longer the typical surgical abortion. It's the abortion pill, where now 62% of all of the abortions in the United States are performed with the abortion pill. And the abortion pill and the morning after pill are very different. They're both still evil, but we need to understand the difference. The morning after pill is taken the morning after, where a woman maybe had unprotected intercourse and was concerned that she might have gotten pregnant. So she takes a pill which will cause her to essentially have a miscarriage. And if she happened to have a 1 or 2 or 3 day, a long pregnancy, it would force her to have a menstrual cycle, and that pregnancy very, very early would pass. Well, how is that different from the abortion pill? Because the abortion pill is not for the morning after. The abortion pill is indicated for 70 mornings after, where the abortion pill is 98% of the time effective in killing the baby in the womb up to 10 weeks gestation. These babies have fingers, toes, they have heartbeats. Most of the ultrasounds that are done for a new OB visit in the United States are done between 6 and 7 weeks. This is 10 weeks. 10 weeks where we can see this beautiful baby's fingers and toes on the inside. The abortion pill is very different because it doesn't just force a menstrual cycle. There's a very important hormone that is released when a woman becomes pregnant. It's called progesterone. And when you get a big word in medicine, progesterone, break it down into little pieces. That's how you understand it. Progesterone is the progestational steroid hormone. This is the hormone that the body celebrates with when they have a positive pregnancy test and it says, hey, we are pregnant. We are not going to have a normal menstrual cycle this month. We are going to release the hormone progesterone and we're going to keep this pregnancy going. The abortion pill attacks the receptors for that hormone progesterone. So at the beginning of the pregnancy, the woman's body is celebrating, going, hey, we're pregnant. We need more progesterone. But it's almost like earphones where you hear music and it's the ballad of progesterone, but the abortion pill is almost like earplugs. And all of a sudden the woman's body can no longer hear that symphony of progesterone. So the woman's body will actually say, well, I thought we were pregnant. Maybe we're not pregnant. Well, if we're not pregnant, then we're going to withdraw all the support for the pregnancy that was there. And then the next day you take some more pills, which cause you to have contractions and pass that pregnancy. And it is wrong, just like any kind of an abortion is wrong. But the majority of all abortions in the United States are now performed with the abortion pill. But the real key with the abortion pill is that when people make bad decisions, and I've made bad decisions, I've said things and I have done things, and I'm like, Bill, that was stupid. Why did you say that? And you wish you could take those things back. There are people who make bad choices when it comes to medication. We had over 110,000 people in the United States last year die of drug overdoses. The number one is with a narcotic, and the number one drug overdose from a narcotic is fentanyl. And when people take fentanyl, they overdose and they're not breathing, they are in the process of dying. Yet, if somebody makes that mistake, we have an antidote, and that antidote is called Narcan. Every cop has Narcan in their car. Every ambulance has Narcan. There are churches that carry Narcan. It is the antidote. It's kind of like waking Sleeping Beauty up. So if a patient came into the emergency room and they're not breathing, the first thing that we do is we give them Narcan. Now, would we ever say, well, tough, you made a bad decision. You're going to suffer the consequences of that bad decision? No, absolutely not. We try to reverse it and cure it. Well, the same thing happens with the abortion pill, where women are very much pressured. All of a sudden they find out they're pregnant. Maybe they're being pressured by their boyfriend or even their husband. Maybe they don't know how they're going to, be able to continue with their job. Maybe they don't know about how they're going to financially manage that. But a lot of women, when they are told, we're going to help you, that's what Pregnancy Resource Centers do an amazing job. Well, they will help meet the needs of those women. Well, across the country, we have a network, abortionpillreversal.com, where we have 500 physicians that are ready and available. We are all based out of a group in Columbus, Ohio, and we have a toll-free number. And you can just go to abortionpillreversal.com for that number. But we have a lot of women who felt pressured. They made a mistake. They recognized that mistake, and they took the abortion pill. Just like somebody who took a narcotic, we have an antidote for the narcotic. just when somebody takes the abortion pill, we have an antidote for the abortion pill. We actually have a window of about 72 hours from the time a woman takes the abortion pill until we can safely reverse the effect of the abortion pill. Well, how do you do that? Well, if the abortion pill was lowering the amount of progesterone in the woman's body, all we do is we give that woman additional progesterone. We reverse the effect of the abortion pill by giving them progesterone. The progesterone that we use is something that, number one, we use in normal obstetrics all the time. We use it to prevent preterm labor and say triplets and quadruplets. We give them progesterone to continue the progestation. Somebody who had a pregnancy and a miscarriage, and then had a pregnancy and a miscarriage, a lot of times they don't have enough progesterone in their body. So with the next pregnancy, we give them progesterone. Anybody who's had in vitro fertilization, where they had embryos transferred to their uterus, they need progesterone. So we give these women this exact same hormone. It is a hormone that is bioidentical to what the mom's body makes on its own. It is extracted from yams and soybeans, and it is available at every pharmacy. So when a woman has taken the abortion pill and have regrets, they can contact one of 500 doctors here in the United States, and we will provide them with the antidote where we can reverse the effect of the abortion pill. I have had 19 women in this exact situation where they were pregnant, they made a mistake, they took the abortion pill, they had regrets, and they contacted me. And we've offered them abortion pill reversal for all 19 of those women. How effective was the reversal medication? Well, 15 of those babies are now alive and doing well out of those 19 that had a 98% chance of dying. And sometimes women realize the mistake that they made might be a day or two. I've had 2 women who actually called me from the parking lot of the abortion clinic where they had already taken the abortion pill and they hadn't even gotten in their car and started it up, yet we were able to minister to them. But there's a spiritual lesson on that as well. 100% of us were walking in a life of sin, and we were going to die, and we were going to we were destined to hell because of our sin. But then we have the reversal. We can be redeemed, and we are redeemed through not a little bit of progesterone. We can actually be redeemed through the blood of Jesus Christ. And what does redeemed mean? It means to buy back. Every reversal that I offer a patient, I offer to pay for the medication because a lot of moms don't have insurance. A lot of moms, even if they have Medicaid, it hasn't kicked in yet. It costs $109 in my area for a complete course of progesterone therapy. I don't want $109 to stand between this baby living and this baby dying. So we have Google Pay, Apple Pay, we have credit cards. I've even driven an hour and 20 minutes to a pharmacy, met the mom at the pharmacy, and just paid for the reversal medication at the pharmacy. Nationwide, we've trained over 500 doctors, and just recently we celebrated documented successful reversal number 5,000. 5,000 babies. And I've been giving pictures. I get pictures sent all the time of the babies that I've delivered. And after 4,000 babies, sometimes they start to look alike and their stories start to be similar. But there's something very special about the pictures of babies that you knew had a 98% chance of dying. But with a little bit of medicine and a lot of prayer, these babies are alive and doing well. And here's the real key. When it comes to reversing the effect of the abortion pill, it is an all or none. It is a green light or it is a red light. There is no yellow light. We're either going to be successful and you're going to have a healthy mom and a healthy baby, or unfortunately sometimes we're not successful and we can't save the life of the baby. What does not happen is you don't get a heartbeat that stays and then do an ultrasound and say, well, you saved the heartbeat, but the baby's missing a hand. We do not see that at all, and will not see that at all. So you really, as long as there's a heartbeat, you don't have anything to lose. But it is an opportunity to help correct a mistake that a woman has made. there is actually legislation in different states that is trying to prevent doctors from actually reversing the effect of the abortion pill. And one of those states is the state of Colorado that had a bill. It went through the House, it went through the Senate, and was signed by the governor that would punish a physician who, at the request of who the mom calls and says, I made a mistake. I took the abortion pill. Is there anything I can do to reverse the effect of the abortion pill? The state of Colorado has a law that was passed and signed by the governor that will actually threaten to remove the license of that physician and fine them up to $20,000. There was a judge who says, this is bad, this is stupid, this is a bad law, and so it's going to be reheard in the state of Colorado. But can you imagine if a doctor were to say, if they reversed the effect of a narcotic by giving them Narcan and gave them the antidote? Can you imagine that doctor being fined and saying, that person made that decision to take that narcotic. Who are you to reverse the effect of that narcotic? No. It is the right thing to do. But just to even have a state that would punish a physician and threaten to take their livelihood away and their license because at the request of a patient, they're trying to save the life of their baby. It is so evil that you realize this is not a choice. This is a spiritual battle that we are engaged in. And if we are engaged in a spiritual battle, we need to have our spiritual tools, which is understanding the Bible, understanding Scripture, and leading with prayer.
We've talked a lot about the risks associated with pregnancy to the mom, but what are the risks associated to mom when an abortion is involved? Are they about the same or are they different?
It depends on the gestational age of the abortion. An abortion, when it's done surgically, is still a surgery, and any surgery has risks. There's risks with bleeding. There's always risk of infection. There's always risk of perforating the uterus and actually doing damage to the bowel on the inside or the ovary or the tube. Any surgery has risks. And even with the abortion pill, there are definitely risks to the life of the mom. Why? Because especially when the abortion pill is available mail order, where you can just call a clinic and they will send you the 5 pills for the abortion pill protocol in the mail, just because you have a positive pregnancy test in no way tells you where the pregnancy is. And this is really important. An ultrasound would tell you where the pregnancy is. So when a woman gets a positive pregnancy test and she panics and she orders the abortion pill online, and it's legal in a lot of states, and then the abortion pill is delivered and she is told in the instruction pack, lady, you're going to have bleeding, cramping, and pain. Well, okay. But with all pregnancies, statistically, 1% of all pregnancies will be an ectopic pregnancy, a tubal pregnancy. And what are the symptoms of a woman who's experiencing a tubal pregnancy? They're the exact same as what they tell them to expect with the abortion pill. The symptoms for an ectopic pregnancy are bleeding, cramping, and pain. How is a woman supposed to know the difference between bleeding, cramping, and pain from an ectopic pregnancy, which is a direct threat to her life, and bleeding, cramping, and pain as a side effect from the abortion pill? We are seeing women coming into our emergency room and they're getting diagnosed with ectopic pregnancies. They're also getting diagnosed with incomplete abortions because the abortion pill is indicated for up to 10 weeks pregnant. Well, if a woman hasn't had an ultrasound, and especially if she has a little bit irregular periods, she doesn't really know how far along she is. Maybe she's 12 weeks along. Maybe she's 14 weeks along. Maybe the abortion pill was strong enough to actually kill the baby on the inside, but the contraction pills were not strong enough to have her deliver that baby. So we're seeing incomplete delivery of abortions where the baby is further along than 10 weeks, primarily because the mom never got an ultrasound. But we're also seeing cases where moms are coming in with ectopic pregnancies, where if they hadn't been told when they took the abortion pill that they need to expect to have bleeding, cramping, and pain, they have delayed seeking help because they think, well, this pain that I'm having is probably normal, so I'm not going to go to the
Mhm.
hospital. And so they wait. They wait hours, they wait days. There was one case, unfortunately, of a young girl who was in a situation where she was pregnant. She got a hold of the abortion pill. She took the abortion pill and she followed the directions, and she started to experience bleeding, cramping, and pain. And was the bleeding, cramping, and pain coming from the abortion pill? No. She actually had a rupturing ectopic pregnancy.
Oh
Her
no.
friends came over to her house. They found her unresponsive. They called EMS. EMS took her directly to the emergency room. They weren't able to resuscitate and revive her. She passed away. They did do a blood test and they found out she was pregnant. And then on the postmortem afterwards to see why she died because she had a ruptured ectopic pregnancy, and she had almost a liter of blood that was there in her abdominal cavity, and her tube had burst and had ruptured from the tubal pregnancy. And I have no doubt this young lady probably would have sought medical care when she first had the symptoms of bleeding, cramping, and pain. But because she was told to expect bleeding, cramping, and pain because she took the abortion pill, she delayed in seeking help. And so that's not good medicine. Abortion is not health care. Abortion is going to take the life of a unique baby with it that is genetically unique from the mom, genetically unique from the dad, genetically unique from the other 8 billion people on the planet. An abortion is going to kill that baby on the inside. That is not health care. When we had in Cleveland, at the Cleveland Clinic, they had over 3 dozen doctors, nurses, anesthesiologists, nurse anesthetists, surgical assistants, and techs that were all involved in one mom and her baby who had a tumor in that baby's heart. And they all worked as a team, and they actually were able to perform open heart surgery and save that baby's life. This baby was 27 weeks along, and the doctors estimated that if something wasn't done, that baby was going to die from this tumor in the heart in 1 to 2 weeks. Yet you had 2 individuals with heartbeats, a mom and her baby, that were cared for by over 3 dozen healthcare professionals. And then who wheeled out of that room? 2 patients also, a mom with a heartbeat and a baby with a heartbeat. That is healthcare, where 2 heartbeats go in, 2 heartbeats go out. Abortion, 2 heartbeats go in, 1 heartbeat comes out. You've lost the lives of half of the individuals when it comes to abortion. Abortion is not healthcare.
I think that the media would have us believe that abortion is just a natural part of obstetrics and gynecology. Do you feel like your opinions as a physician are rare in your field, or do you see more than the media would have us believe agreeing with the work that you do?
When it comes to obstetricians, people who went 4 years of college, then went to medical school for 4 years, and then did 4 years of residency training to be able to do the job that they do, an OB/GYN. And we're taught we want to have healthy moms and healthy babies. And it's not normal. It's not the majority. ACOG. ACOG is obviously the group, the American College of Obstetricians and Gynecologists, which is pushing abortion. They are in favor of the abortion pill. There's even a fellowship now called Complex Family Planning. How even though you've gone through 12 years of intense training to have healthy moms and healthy babies, you can now do a recognized fellowship for 2 more years where you are trained in how to do later term abortions. Or say a mom finds that she's pregnant with quadruplets, and there's going to be a lot more issues and increased risk of preterm labor and preterm delivery with the quadruplets. Well, with complex family training, they will actually offer to do a selective abortion where if there's 4 babies on the inside, they'll say, you know what, instead of having 4 babies and having the risk of preterm labor, why don't we just go in and we'll just abort 2 of those 4 babies? How do you possibly choose? This is Sophie's choice. It's evil. but there are also pro-life OBGYNs. And this doesn't have to be a religious issue. There are a lot of atheists who are pro-life. There are a lot of people that just don't practice any form of religion who are pro-life. They recognize the value of life. There's an organization called APLOG. APLOG is the American Association of Pro-Life Obstetricians and Gynecologists. And the last time I checked, the membership of APLOG was over 7,000 OBGYNs nationwide who don't just say, yeah, I'm pro-life. I don't do abortions. No, these are people who are paying dues and are stepping up and saying, no, abortion is wrong. The mom is my patient. The baby is my patient. I'm going to put my name out there, and I'm going to pay dues, and I'm going to do what I can to support and defend the babies in the womb. So it's not that all OBGYNs are in favor of abortion. There are thousands and thousands of OBGYNs who are caring for moms and babies who not only won't do abortions, but are taking a stand and saying abortion is wrong.
That is awesome. So we are both Floridians, and coming up in November is Amendment 4, which all of us Floridians are going to be voting on. I know that a lot of the information that's going around about it has been that it has no definitions, no doctors, and no parental consent. What is your thoughts on the no doctors part of Amendment 4? Is that true? And do you think that a doctor really is necessary when you're making these decisions?
Well, one of the important things is that the people have spoken in Florida. When I took over my practice, you could legally perform an abortion up to 24 weeks gestation. Then with a lot of effort and work and through the legislature, we brought that down to 15 weeks. Then on May 1st of 2024, the House and the Senate passed, and then it was signed into law by Governor Ron DeSantis, of a heartbeat bill where life would be protected up to 6 weeks gestation. And we were getting ready to have new legislation which would have put new restrictions on availability of the abortion pill in Florida as well. And then we have Amendment number 4, which would be an amendment to the Constitution of the state of Florida. They've already invested over $20 million in this bad amendment number 4, primarily funded by the ACLU of Florida and Planned Parenthood of Florida. Of course, Planned Parenthood is not about planning when you're going to be a parent. Planned Parenthood is about aborting and killing the baby in the womb. But they've invested over $20 million on Amendment 4. What is Amendment 4? Amendment 4 will be on the ballots in November. If Amendment 4 gets at least 60% of the votes, then abortion at any gestational age for any reason would be legal in the state of Florida. And there's a lot of problems with the way this amendment is even written. It says that there would be no restrictions on abortion up until viability. Did the amendment even define what viability is? No, but most people would say viability is between 23 and 24 weeks. But then there's a second clause that says, or if the mother's health is threatened as determined by her health care provider. Well, first, it didn't define health care provider. I mean, the Florida Department of Health, yes, it licenses doctors and nurses and nurse practitioners, but there are a lot of other professions. I mean, chiropractors, dentists, should they have the ability to help a woman make one of the toughest decisions in their life? Are they going to be able to handle any kind of complications? No. So healthcare provider was not defined. But the real key was even the word health was not defined. And there's one definition of health which was used in a Supreme Court case called Doe versus Bolton. And that decision was made the same day as Roe versus Wade in 1973. Well, how did this case define health? It said that health was defined broadly. It said health was physical, emotional, psychological, familial, and age. It's so broad, there were no limitations on health. This is not a matter of the woman has an ectopic pregnancy, and if we don't do something, the mother is going to die. It has absolutely nothing to do with this. It says, well, maybe the mom's too old. Maybe she's too young. Maybe her mom doesn't want her to have the baby. Her dad doesn't want her to have the baby. Boyfriend doesn't want her to have a baby. So essentially, if Amendment number 4 passes in November, abortion at any gestational age for any reason would be legal in the state of Florida. It's just such a new level of evil in Florida. And what's the motivation? Why would anybody want to do that? Well, a lot of it has to do with money and greed, because there's a lot of money in abortion and there's a lot of greed that is involved in the abortion ministry, or not even a ministry, in the abortion business. When it comes to the greed, sure, that's a huge factor, but I think it goes even deeper than that, because at its core foundation, what is abortion? Abortion is much more than just attacking a pregnancy. We are scripturally in Genesis 1:26 that we are created in the image of God. Well, when are we created in the image of God? I mean, I've delivered 3 babies already today. Were they just blobs up until I delivered them? I mean, I induced one of them. Do I have the ability and the power to determine when somebody's going to be created in the image of God because I pick their induction date? No, it doesn't even make any sense. The only thing that makes sense of when we're genetically a new person is when a living egg from the mom and a living sperm from the dad come together. It's not just life. This is a brand new life. A living self from the mom and a living self from the dad came together. And that is being created in the image of God. So we are created in the image of God at that moment of conception. So at its core, what is the foundation of abortion? It is an attack against that image of God. If you've ever seen somebody burn the American flag, it's like, what good does it do to burn the American flag? Why would you burn the American flag? If somebody hates the United States and they want to destroy the image of the United States, the American flag represents the image of the United States. So to, extirpate and to, express themselves in their hatred for the United States, they will burn the American flag. Same is true with abortion. We're created in the image of God at the moment of conception, and that baby at any gestational age represents the image of God. So abortion is a reflection of hatred for God. So if you hate God, you'll want to destroy the image of God. If you hate the United States, you'll want to destroy the image of the United States, which is the flag. They go hand in hand. This is an attack on the image of God. And is it wrong? Absolutely. Is abortion a sin? Sure. It's an attack on the image of God. Is it a mistake? Sure. And tens of millions of men and women have been involved in this mistake. And is it just outside the church? No. Recent studies showed that between 18 and 24% of all of the men and all of the women in different congregations and churches have personally been involved with an abortion. Is this the unforgivable sin? No. The blood of Jesus is able to cover even the sin of abortion, even the attack on the image of God in the womb. I mean, that's why Jesus came. He lived a perfect life. He gave his life for all of us, and he was buried. He was dead 3 days in the grave. But miraculously, he conquered death. He rose again because he is God. And if we put our faith in Jesus, then even the sin of abortion we can be redeemed from. We can be forgiven. So these men and women who have had abortion as part of their life, they are hurting. When you are hurting, you need healing. Healing comes from forgiveness, and true forgiveness only comes from the blood of Jesus Christ, which is why this spiritual issue, this spiritual battle must be preached from our pastors up our pulpits. Our pastors, our priests, and our rabbis need to be discussing what abortion is, why it is evil, but even though it is evil, that it can be forgiven through the blood of Jesus Christ. Number one role of the church, it's got to be about the gospel, to teach that we are all sinners, but we all are destined to hell. But because of the blood of Jesus, we can be redeemed and we can be saved. The gospel has got to be part number one, role of the church. What's number two need to be? It needs to be a battle against abortion, because this is an attack on the image of God. Since 1973, we've had over 63 million babies aborted in the womb. Babies with heartbeats, babies with fingers and toes, created in the image of God. And it's like, well, how does that affect the United States? Because we are a nation founded on godly principles. I mean, we look at ourselves and we say we're one nation under God. When you look through Scripture, you look through Judges 3, 4, 5, and 6. Did God love the nation of Israel? Absolutely. I mean, they were his chosen people. But then the children of Israel started to commit sins. And what happened? Well, God said, you know what? You are not only am I just going to say you're on your own, good luck. He actually strengthened the enemies. He delivered the children of Israel into the hands of their enemies. So when we're fighting for life and we're fighting to defend the image of God and do what's right into the eyes of God, we're really doing this to prevent judgment from coming on the United States. When I'm speaking at centers around the country, or when we have our new curriculum we've been working on for over a year, when we produce this information, am I doing this to save the life of the baby in the womb? Sure. That's always first priority. Save that life of the baby. But who else am I doing this for? I'm doing this for my kids, and I'm doing this for my grandkids, because I want them to grow up in a one nation under God. I don't want judgment to come on this great nation that I love, the United States of America. So I'm doing this for the grandkids that I don't even know yet. My one daughter is married. My second daughter is getting married in October. I'm doing this for my grandkids. Thank you. So, but it's an issue that, especially, I'm almost 60 years old. So this is an issue that, things, what has happened, and it's behind us. But we really need to redeem this nation, to make it get back to its roots, get back to its one nation under God, and defend the image of God, because I don't want judgment to come upon this country. I want my children to grow up in the same blessed nation that I had the honor of growing up in.
What would you say to a mom who is struggling with, who's pregnant and in crisis, and really trying to weigh her options, really believing the lie that maybe abortion is a safer option for her than pregnancy? How would you encourage her?
First, encourage her and let us say, congratulations, you've been blessed. There are so many people that are struggling to get pregnant, that are waiting on the list. We have over 1 million people trying to adopt babies, people going through in vitro fertilization. If you're pregnant, you have a positive pregnancy test, you just have one of the biggest blessings in your life. And you're not alone. There are people that are there to help you. There are over 3,000 pregnancy resource centers here in the United States, and there are Heartbeat affiliated centers. There are CareNet affiliated centers. You go into your phone book and you just put in Pregnancy Resource Center. I guarantee you will find a center in your town that is there to help you. And they are not just there to help you make the right decision. They are there to meet your needs. They are there to help you get access to insurance. Sometimes they can even provide you with housing. They'll provide you with all the things that you're going to need for your baby, from diapers to clothing. This is their ministry. This is what God has called them to do. But they don't just minister to the moms, they minister to the dads as well. Because a lot of dads have come from families where there was not a dad in their youth and when they were growing up. And they are doing this out of love. They're not going to charge you. They're going to meet your needs. And so you're not going to go through this alone. There are thousands of men and women who are out there to help you not only make the right decision and to save the life of your baby, but also to meet your financial needs and spiritual needs and even housing needs and even educational needs. A lot of centers now even had great access to getting your GED, getting a degree, getting some sort of a skill that you can use to support your family. And they do this out of love for you and that baby that you're carrying, that image of God. Of the babies that I have delivered after we have used abortion pill reversal, one of the things, it's a beautiful thing to deliver a baby that you knew had a 98% chance of dying. Yet a little bit of medicine, a little bit of technology, a lot of prayer, and that baby is perfect, and then you've delivered that baby. But 100%. When you meet with those moms at the 6-week visit where they had their baby 6 weeks ago, you can't help but sit there and say, you are a blessed woman. Dad, you are a blessed man. You have a beautiful baby. But then you can't also help but think, can you look back where we were 9 or 10 months ago? Can you look back and think about what your life, as they're sitting there holding this beautiful baby in a beautiful little outfit, and they're so proud of their baby, but they came so close to losing the life of that baby. And I have never had a patient who has in there in my office holding that beautiful baby and look into the eyes of that baby and say, you know what? I made the wrong decision. I should have just kept up with the abortion pill. No, never seen that. Everybody, we all make bad decisions. We all make bad choices. There's a story about the Golden Gate Bridge. Sadly, the Golden Gate Bridge is beautiful, but it's also the most popular place where people will go to commit suicide. And over 2,000 people we know have jumped off the Golden Gate Bridge. And their stories are consistent. They're looking at their lives and they say, nobody loves me. Nobody cares for me. Nobody's here to meet my needs and get me through my day. And they walk out to the Golden Gate Bridge and they jump off the Golden Gate Bridge. And they've invested over $100 million now on a netting system underneath the bridge to try to catch these people. But does everybody who falls 200 feet to the water below die? No. In fact, a psychologist heard that there were 29 people that are known to have jumped off the bridge but have survived. So the psychologist actually tracked down 29 of these people, and she interviewed them. And they all had the same story. They walked out onto the bridge thinking they were alone, that this was, not worth living, and that nobody loved them, nobody cared for them, nobody was willing to help them out. And they figured, my life will be better if I just jump off this bridge. But then they all jumped. But then she asked them, for that 4 seconds when you were falling from jumping off the Golden Gate Bridge, what was going through your mind at that point? 29 of 29 said the exact same thing. They all said they had immediate regrets and they regretted jumping off the bridge, even though they were positive 5 seconds ago that they wanted to jump off that bridge when they were actually falling off that bridge, and they realized that their life was threatened. 29 of 29 had immediate regrets, and some of them even cried out to God and said, I don't want to die. By some miracle, they all hit the water. Some of them were fished out by fishermen, some of them the Coast Guard, some of them swam and made their way to shore. And they realized that, but that's the same thing that happens with a woman who's facing an unplanned pregnancy, where they think when they're so scared that they don't have any options, where they think that just getting an abortion pill will help me get rid of this stress that I am having. And it doesn't work that way. They have regrets. And women are hurting decades after they've had an abortion. I mean, I've spoken with women who are now in counseling and seeing psychologists and psychiatrists. And when you trace it back, so much of it goes back to the trauma of when they had an abortion. A lot of these women, had a blessing. They had a beautiful baby on the inside. They were given bad advice, or they were pressured, and they were influenced, and they aborted that baby. But it's amazing sadly how many of those women didn't realize that might have been their only chance to have a baby. I've had women who struggled with infertility, and no matter how many tens of thousands of dollars they spend on reproductive endocrinology, in vitro fertilization, seeing specialists all over the world, they can't get pregnant. And how can you not look back to when you were in high school or college and say, if I knew that was my only baby, I would have had an abortion. They have a lot of regrets. So we're there to not criticize them. We're there to share love and to meet their needs, but also to share about salvation and forgiveness, because true healing comes from forgiveness, and that only comes through Christ. And that's the role of the pregnancy centers. They're there to meet all of your physical needs as much as they can, your medical needs as much as they can, your psychological needs as much as they can, but they also want to share the gospel with you and share you the love of Jesus.
Thank you so much, Dr. Lile. It's really been a privilege getting to hear all of your massive wealth of knowledge on this entire subject and your care for your patients. I appreciate it so much. Where can we find more of your work? You mentioned Pro-Life Doc and the resources that you've just had come out recently. Can you share how we find that?
Sure. We have lots of resources that are available on all the social media outlets, but the best source is to go to our website, which is prolifedoc.org. And right now we just released our new curriculum. It is 8 hours of video training, lecture training, examples of fetal surgery, examples without any blood or baby parts of what a first, second, and third trimester does, in an abortion. It is probably the most comprehensive pro-life apologetics course that has ever been created. You can actually go to the website and you can download chapter 1 for free. You can watch all the video associated with chapter 1 and even download the workbook. We want to provide tools as a tool that we can use together to defend God's preborn in the womb. And this is an excellent tool.
Thank you so much, Dr. Lile.
Oh, you're welcome.
Two patients, two heartbeats. Any doctor knows this is true. And I love when we have the support of those doctors and they care for our babies just as much as they care for us. Oh my goodness, motherhood is hard when you're pregnant, when you have toddlers, when you have grown children. It is always hard. And I love that we have doctors like Dr. Lile. We have pregnancy resource centers to give us diapers when we're having a hard month. That we have churches to be there for us, to help support us on this journey that is more than just physical, that is spiritual as well. And I love that we have friends. We have other women to be there for us in those really hard moments when things really, really suck. And there's so much pain in what we're facing and what we're expected to rise to the occasion to overcome. We have other women who've been through pain just like ours, who've been through fear just like ours, who've been through joy just like ours. And so much we can learn if we just lean on each other and share our stories. Never give up. Thank you so much for hanging around through the end of the episode. I hope today we have shown you that all life is worth living. Just like in the book of Esther, where God paints a beautiful portrait from the background, God is painting a portrait with your life, and we can learn so much from each other if we simply share our stories. Whenever it feels like the darkness is pressing in, just remember the words of Jesus Christ in John chapter 9. As long as I am in the world, I am the light.